Hello, guys. Good day. This is Anna Free Reinforcement Club. Today, we are going to talk about rabies infection in humans. Rar, rar, rar. I haven't encountered this case ever before, but I just inject vaccines, rabies vaccines, because once a patient comes to the hospital with manifestations of rabies infection, they are immediately in the isolation. There's no room for rabies infected persons in the hospital because they are highly contagious and dangerous. They're already in the late stage when these people who aren't really aware about the infection comes to the hospital with the signs and symptoms. They are usually in late stage, which means that the intervention would less likely to work or wouldn't work at all. Now, rabies is a viral disease caused by lyssavirus, transmitted through direct contact with the saliva or nervous system tissue of an infected animal. Direct contact means you get in touch via mucous membrane of the eyes, nose, and mouth, or by means of broken skin through animal bites and scratches. Rabies is common in bats, skunks, raccoons, foxes, cats, and dogs. According to the WHO 2023, rabies is more common in 150 countries and territories with thousands of deaths per year in Asia and Africa, 40% of whom are children below 15 years old. Most of all, dogs are the main source of human rabies deaths, contributing up to 99% transmission to human. The rabies virus usually moves slowly from the muscle down to the spinal cord to the brain, leading to neurological symptoms to coma and death. How does rabies affects the body? Now, once a person is bitten by an infected animal, he will undergo in with this four stages. The first one is the incubation period, the second one is the prodromal phase, the third one is the neurological phase, in which the rabies have already reached the brain, and the fourth one is coma. Now, let's dive into the incubation period. Incubation period is the time between the exposure and the appearance of the symptoms. Usually, the infected person has no symptoms at all. But this is the best time to receive treatment because once you've already taken the treatment, early intervention in the incubation period, you're not going to have rabies. All right? And the incubation period varies on the location of the exposure site. So it means that incubation period varies on the distance of the the open wound, which is animal bite or scratch, to the distance of the brain, your brain. So when you are bitten here on the leg, it will undergo to the virus will, how do you call that, colonize the muscles, and then it goes to your nerves and then to the spinal cord and then to your brain. And that takes time. So it's way better to bring yourself to the nearest clinic or hospital or animal bite center as early as you can when you are bitten by a dog or suspected animal with rabies. Another thing is that incubation period varies on the types of the rabies virus that you're going to get. And if you have existing immunity, if you have bitten by an animal before and you get vaccinated, so that also affects the incubation period. But above all, get yourself a treatment when you suspect that the animal who bite you or query rabies. Get yourself treatment right away. The next stage is the prodromal phase. So this happens when when rabies virus travels through the nerve cells already. They're already on the spinal cord in the axons and ganglions, and some of them might have gone already into the brain, causing neurological damages. And the typical reaction of the body, of course, it will fight back by means of flu-like symptoms. So the patient or the infected person will manifest fever, muscle weakness, headache, wound burning on the affected site. It could be animal scratch or animal bite on the legs or hands, itching and numbness on that site, plus nausea and vomiting. And at this stage, the treatment, which is given by the hospital or the healthcare provider, would less likely to work, or it wouldn't work at all because it already reached the brain. And as this viral infection called rabies have already colonized the nervous system progressively, then it is now called to be the acute neurologic phase, which means that the virus is actively damaging the brain and the spinal cord. When the rabies virus have already got themselves in the brain of a human being, usually the infected person will exhibit two types of neurological symptoms. The first one is the furious, and the second one is the paralytic neurological symptoms. Furious means there is a come and go of rabies symptoms with periods of calmness in between. So, under this furious neurological symptoms, the patient or the infected person will display agitation and aggression, restlessness, seizures, hallucination, racing heart rate, excessive salivation, facial paralysis, hydrophobia or fear of the water or fear of drinking water, delirium, and even aerophobia. They are scared of an air getting away on their face. Under the paralytic signs and symptoms, the infected person would display fever, neck stiffness, weakness from the body part that was bitten to the other body parts, tingling sensations generally, and then paralysis down to coma or unresponsive, unconscious state, but still alive. How rabies is diagnosed. So, once you got an animal bite of a suspected dog, it's important to really wash it with soap and water gently. Then call your healthcare provider or go to the nearest clinic, hospital, or animal bite center. So most of them, they're not going to wait for any signs and symptoms of rabies. They are going to give you the intervention as quickly as they can. Of course, they're going to examine your wound, and they're going to ask what kind of animal that has give you this bite or scratches, or whether they're going to ask whether they can test or observe the animal who bite you. However, when they decided to test the animals, they usually euthanize the animal. And for the test of rabies, so you're going to get a rabies test, they're going to test your saliva. They're going to get the skin biopsy. Sometimes the infected person is going to undergo a lumbar puncture. So that is cerebrospinal fluid collection by means of lumbar puncture here between the L2 to L4. They're going to, your healthcare provider is going to collect the CSF fluid to check if there is a presence of rabies virus, and they're going to get some of your blood tests. So this saliva test, skin biopsy, lumbar puncture, and blood test, the healthcare provider will likely to have this thing done to check if there is a presence of rabies virus. And sometimes, when necessary, the healthcare provider will also conduct an MRI to determine the cause of the symptoms if they decide to. Now, for the treatment and management of the animal bite, of any animal bite, especially to those infected animal bite, first of all, when you experience this, it's way better to clean the wound with soap and water gently. and then bring yourself to the nearest clinic or hospital, which can give you the quickest intervention. So most likely you're going to get a series of vaccination shots plus antibody shots on the wound, directly on the wound. If you never got or never have got any vaccinations for rabies before. So rabies vaccines usually are 4 shots over 14 days or 2 shots if you've already been vaccinated. So just like me before, when I got bitten by my dog, I only got 2 shots, and that is absolutely free in the city health. That's actually in the Philippines. And to some people, especially if it's really worse, we got animal bite in the on the face. So other than the rabies vaccines that they receive here, intramuscular, these people will also get the so-called human rabies immune globulin shots around the wound. So if it's on the face, they're gonna get the immune globulin shots on the face too, which is painful, but of course, life saving. Again, when you are bitten by an animal, especially suspected animal, even if that is your gentle dog, wash the wound with soap and water gently and call your healthcare provider as soon as you can. Bring yourself into the clinic as quick as you can and have yourself vaccinated as soon as possible. That is the only way to avoid rabies infection. Now, why does rabies infected person or patient experience hydrophobia or fear of water? Now, rabies infection causes intense spasm in the throat when the infected person tries to swallow. That even the thought of swallowing causes spasm and even painful convulsions, making them appear that they're scared of water. And that's the reason why that even their own saliva, they wouldn't swallow it. They're kind of they even exhibit an excessive salivation, and their saliva contains rabies virus. So they are dangerous and highly contagious. Now, why there is no cure for rabies infection? So, according to research, virus totally locks the blood-brain barrier. Inside our brain, we have the so-called blood-brain barrier, so which is composed of blood vessels in our head, under our skull. This actually acts as a protection of our brain from any toxins and dangerous substance. But not only rabies can penetrate the blood-brain barrier, even alcohol, substance abuse drugs, it could be some water tablets, or even sedatives and anesthesia, they can cross towards the blood brain barrier and it alters our consciousness totally. So, although it protects the brain, but there are some exceptions, and rabies virus happens to be one of the exceptions. So, extra careful because any treatment will be denied. The blood brain barrier is already locked by the virus, by the viral infection itself. How to prevent rabies infection? Now, I got here a few tips from Cleveland Clinic. So, here they have 6 tips to prevent rabies. The first one is make sure your pets are vaccinated and those vaccination must be up to date. The second one is don't let your pets roam free without supervision. The third one is leave wildlife alone. Don't touch injured animals, especially if they're not yours. Number 4 is bats are the most common source of rabies in the US or any developing countries. If you find a bat where you were sleeping, assume you've been bitten. Number five is if you're at high risk for rabies, ask your provider about pre exposure prophylaxis, which is the vaccination. And lastly, if you've been attacked by an aggressive wild animal, call the animal control too. If you have this group of people or government supported people in your community. Now, in terms of the pre-exposure vaccination, this is actually based on your local health authority if you have guidelines in your country. So prophylaxis usually have two shots plus boosters depending on, if you really need it. For example, if you work in a certain uh, area wherein you usually get in touch with hang out with the wildlife and domesticated animals like vets, or you are part of the animal control officer, so it's way better to get this pre-exposure vaccination. And if you are working on, like, let's say that you are a biologist, you usually, you have a project wherein you have to go to some caves much often, or you'll be around with the bats, so better to get this pre-exposure vaccination. Or when you travel to an area wherein rabies is common in dogs, so get this vaccination, please. And of course, when you work in a lab wherein you're gonna get around with this rabies virus, so get the vaccination. So all in all, rabies is a fatal viral infection, but completely preventable if treated right away. Prevention is better than cure. So that's it for today, guys. This is Anne once again of Free Enforcement Club telling you, you never lose, you either win or learn. Be extra careful. Have a lovely day ahead. Thank you very much for your time. And if you love this content, this video podcast, please follow, like, and share. I am also in Spotify and Apple Podcast. So thank you very much.